Chymoral Forte tablet, uses, dosage, side effects, and safety tips. Chymoral Forte is a specialized proteolytic enzyme preparation containing a combination of trypsin and chymotrypsin. It is commonly used as an anti-inflammatory and antioxidant medication primarily for treating conditions involving swelling and inflammation. The medication has shown particular efficacy in reducing postoperative swelling, managing blood clot-related tissue inflammation, and alleviating pain in various inflammatory conditions. What is Chymoral Forte? Chymoral works as an anti-inflammatory and antioxidant. It is mostly used to treat conditions such as swelling caused by blood clots in the tissues. The Chymoral Forte tablet is used for the treatment of post-surgery swelling and discomfort, necrotic tissues, swollen muscle injuries, and chronic respiratory disorders. It aids in intracapsular cataract retrieval, reducing the amount of trauma experienced. Mainly the medication is used for the treatment of pain and inflammation. Chymoral Forte benefits include alleviating severe pain and swelling in postoperative wounds and other inflammatory conditions. What are the benefits and uses of Chymoral Forte? Chymoral Forte works as an anti-inflammatory, antioxidant, fibrinolytic, and anti-edematous agent. Its unique properties enable it to facilitate tissue repair and reduce inflammation. Condition Chymoral Forte treats. Chymoral Forte is commonly used to treat post-surgical swelling and discomfort, soft tissue injuries, fractures, dislocations, sprains, and strains, necrotic tissues, swollen muscle injuries, pelvic inflammatory disease, episiotomy and abdominal hysterectomy, tooth extraction and periapical abscess, maxillofacial surgery, hematoma, chronic respiratory disorders. Secondary uses of Chymoral Forte. Besides its primary applications, Chymoral Forte also helps with relieving pain due to sore throat and sciatica, aiding in the quick healing of sprains and post-surgical scars, improving digestion and protein absorption in the body, reducing inflammation in asthma and other respiratory conditions, alleviating pain in hemorrhoids, piles. How does Chymoral Forte work? Chymoral Forte contains proteolytic enzymes that break down proteins into smaller fragments, making them easier to absorb into the bloodstream. This mechanism improves blood flow to painful and swollen areas. The trypsin-chymotrypsin combination helps modulate the inflammatory process by reducing pro-inflammatory mediators, thereby accelerating the healing process. Trypsin specifically hydrolyzes peptide linkages involving the carboxyl groups of arginine and lysine, while chymotrypsin acts on peptide linkages involving phenylalanine, tyrosine, and tryptophan, providing a complete proteolytic spectrum. Additionally, the protein-bound fraction of the drug exerts direct fibrinolytic activity at the inflammation site, improving microcirculation and dispersion of tissue fluid. Chymoral Forte dosage. Chymoral Forte dosage is determined by the severity of the condition and should be taken as prescribed by a healthcare provider. The medication is most effective when taken on an empty stomach. Typical dosage instructions. Adult dosage. Standard dose, 1 tablet taken 2 to 3 times daily. Severe cases, initially, 2 tablets 3 times a day, then reduced to 1 tablet 4 times daily. Administration. Take on an empty stomach, preferably 30 minutes before meals or 2 hours after meals. Treatment duration, typically lasts for 10 days until swelling subsides completely. Special populations. Elderly, dosage adjustments may be necessary based on individual health status. Renal or hepatic impairment, caution is advised, consult a healthcare provider. Pediatric use, generally not recommended for children unless specifically directed by a healthcare provider. What should I do if I miss a dose? If you miss a dose of Chymoral Forte, take it as soon as you remember. However, if it's close to the time for your next dose, skip the missed dose and resume your regular dosing schedule. Do not take a double dose to make up for a missed one, as this may increase the risk of side effects. What happens if an overdose? Exceeding the recommended dosage of Chymoral Forte will not enhance its effectiveness but can lead to adverse effects such as dizziness, drowsiness, vomiting, nausea, gastrointestinal discomfort. If an overdose is suspected, seek medical attention immediately. What are the side effects of Chymoral Forte? While Chymoral Forte is generally well tolerated, it may cause some side effects in certain individuals. Awareness of these potential reactions is important for safe usage. Some of the common side effects of Chymoral Forte are stomach pain, diarrhea, skin rash, itching, shortness of breath, indigestion, abdominal pain, bloating, inflammation in the eyes, hypersensitivity reactions, corneal swelling. Chymoral Forte can cause some serious side effects and can lead to some serious health problems. Talk with your doctor if you are having any serious problems. How to use Chymoral Forte? Chymoral Forte dosage is determined by the severity of the condition, with the doctor initially recommending 2 tablets 3 times a day in extreme cases. The dosage is then reduced to 1 tablet 4 times daily. Treatment typically lasts for 10 days until the swelling subsides completely. It is most effective when taken on an empty stomach, preferably a few hours before meals, and should be started immediately or as soon as possible after symptoms of edema appear. Precautions and warnings. Proper precautions are essential to ensure the safe and effective use of Chymoral Forte tablet, especially in individuals with underlying health conditions or specific risk factors. Who should avoid Chymoral Forte? Chymoral Forte is not recommended for individuals with the following conditions: severe liver or kidney impairment, peptic ulcers, high intraocular, vitreous, pressure, known hypersensitivity to Chymoral Forte composition or its ingredients. These conditions may increase the risk of side effects or reduce the effectiveness of the medication. Conditions requiring caution. Use Chymoral Forte with caution in individuals who have bleeding disorders, active internal bleeding, pre- or post-surgical conditions, gastrointestinal diseases. In such cases, your doctor will assess the risk-benefit ratio before prescribing the medication. Age restrictions for Chymoral Forte. Chymoral Forte dose is generally not recommended for children unless explicitly prescribed by a healthcare provider. Elderly patients may require dosage adjustments based on their overall health, liver, or kidney function. Always consult your doctor before starting or adjusting the Chymoral Forte dosage per day. Alcohol and food interactions. There are no well-documented food interactions with Chymoral Forte. However, alcohol consumption may interfere with the medication's effectiveness or increase the risk of side effects. It's best to avoid alcohol while taking Chymoral Forte tablet or consult your doctor for personalized advice. Warnings for serious health conditions. 1. Use in pregnancy. Animal studies suggest that Chymoral Forte may pose risks to the developing fetus. Therefore, it should only be used during pregnancy when clearly needed and under medical supervision. Your doctor will weigh the potential benefits and risks before prescribing it. 2. Use during breastfeeding. Chymoral Forte may pass into breast milk and could cause allergic reactions in infants. If you are breastfeeding, consult your doctor to determine whether the medication is safe for you and your baby. 3. Pediatric safety. Chymoral Forte age limit. This medication is generally not prescribed for children unless specifically recommended by a healthcare professional. Extra caution is advised due to the risk of adverse reactions in younger patients. Always follow your doctor's instructions when using Chymoral Forte. If you have any health conditions or are pregnant, breastfeeding, or taking other medications, make sure to inform your healthcare provider to avoid complications and ensure proper dosage and safety. Possible interactions with other medications. Chymoral Forte may interact with certain medications, potentially affecting their efficacy or increasing the risk of side effects. Drug interactions. Anticoagulants. Avoid concurrent use with medications like clopidogrel, warfarin, or heparin, as this can increase the risk of bleeding. Antibiotics. Combining with antibiotics such as penicillin and chloramphenicol may increase the risk of side effects like nausea, vomiting, stomach upset, and diarrhea. Herbal supplements. Systemic proteases may increase the effectiveness of certain herbal supplements. Always inform your healthcare provider about all medications, supplements, and herbal products you are taking before starting Chymoral Forte. How should Chymoral Forte be stored? Proper storage of Chymoral Forte ensures its effectiveness and safety throughout its shelf life. Recommended storage temperature. Store Chymoral Forte tablets at room temperature, ideally between 68 degrees Fahrenheit and 77 degrees Fahrenheit, 20 degrees Celsius and 25 degrees Celsius, in a cool and dry place. What happens if Chymoral Forte is not stored properly? Direct contact with heat, air, and light may damage the medication and reduce its effectiveness. Improper storage may lead to degradation of the active ingredients. Keep Chymoral Forte out of sight and reach of children. Store in a dry place, away from direct sunlight and moisture to maintain its potency.